Hello, welcome back, everyone. And it's a real pleasure to welcome you all today to the second keynote at this ADI conference. So my name is Victoria Stead. I'm a senior research fellow and an anthropologist here in the Alfred Deakin Institute for Citizenship and Globalization. And I'm one of the co-conveners of this conference. So I'm joining you today from Wurundjeri country, where Deakin University's Burwood campus is based. So I'd like to begin by paying my respects to the Wurundjeri people of the Kulin Nation as the traditional owners of this unceded land, and to pay respects to their elders past and present. I acknowledge too the Indigenous owners of all the places from which others are joining this conference, including those joining from outside of Australia on other sovereign Indigenous territories. And I extend a particular welcome and acknowledgement to those First Nations people who are joining us today. So my very enjoyable task is to introduce Professor Janet Roitman. Professor Roitman is University Professor in the New School in New York, where she founded and currently directs the Platform Economies Research Group. She's also an honorary professor at RMIT University here in Melbourne. Professor Roitman is an anthropologist and has conducted extensive research in Central Africa with a focus on the anthropology of value and emergent forms of the political. Her first book, Fiscal Disobedience, An Anthropology of Economic Regulation in Central Africa, published in 2005 by Princeton University Press, is an analysis of unregulated commerce in the Chad Basin and emergent forms of economic regulation and transformations in state governance. Her subsequent research has focused on the concept of crisis, inquiring into the constitution of crisis as an object of knowledge and social inquiry. In 2014, she published Anti-Crisis through Duke University Press, and it is a work I have here on my desk, not just so I can use it as a prop in this introduction, but because it is a book that I have found myself turning to in my own work over these past 18 months for what it illuminates about the troubling occlusions and political effects of using the concept of crisis as a narrative device and a frame for the present moment. So it is, of course, incredibly timely and apt that we have Professor Roitman deliver this keynote address as part of our conference. And we are excited to hear her lecture this afternoon, Framing the Crisis, COVID-19. So Professor Roitman, thank you and welcome, and over to you.
Thank you so much. It's a pleasure to be here, even though online. I really want to thank very quickly, though, the conference co-conveners, Victoria, Stead, thank you, and thank you for that really generous introduction. But thank you, most of all, for the invitation to present this work, which is recent thinking for me. And I also want to thank Emma Kobal and Tim Neal, who sort of first reached out to me and made this possible. And I'd like to also pay my respects to the Wurrung and Boon Wurrung peoples on whose unceded lands I'm standing, and to acknowledge elders past, present, and emerging. Sort of along those lines, I'd like to say, just as a little bit of a preface, that what I'm presenting today started in my apartment in New York City. I was trying to think through various things in the midst of sort of a dire situation in New York City. And so what I'm presenting today will mostly have reference to the United States. But I'm hoping that in the Q&A, which I hope will just be a conversation, we can then maybe talk a little more about Australia and global politics. Yeah, so on that note, given the past 2 years, it's almost 2 years. It seems almost heretical to take issue with the concept of crisis, right? Like, we are in crisis. Nothing could be more self-evident, right? This global pandemic has, ravaged the human species, and it's a crisis. But today, I'd like us to just slow us all down, so that we can consider what I call the entailments of that claim. So while it seems indisputable, right, like COVID-19 is a crisis, I want to ask first, what does this statement signify? So for one, this is a declaration about a virus, and it's a declaration that gives structure to an amorphous phenomenon. So in other words, I want to suggest that the virus becomes an event, right? And the ongoing flux of phenomena through this performative declaration. And that's because really at its most basic level, crisis is a term that creates narrative structure. It's a means to define an event, and it's a means to delineate a beginning and an end, right? Which is something I think, as we're learning now, real time, that's practically impossible in the case of a virus living in our midst. So we really must also remember, and this is sort of the point of the book that Victoria so kindly lifted up for you to see, we must remember that crisis is a concept. And I want to explain that point today. I'll relate my comments to the current pandemic and to the themes of the conference, which are important. And I want to do that by first saying something about how I came to this original project on the concept of crisis. So let's flash back, if you can, to the early 1990s. Quite some time ago, I was living in Cameroon in Central West Africa. And this was a time of economic reforms in most of Africa, definitely in Cameroon. What we used to call structural adjustment programs, we now refer to them as austerity measures. So skipping over a ton of stuff, at that time, people in Cameroon were constantly speaking about every aspect of their lives in terms of crisis. And that inspired me, along with the social theorist Achille Mbembe, to write an article entitled Figures of the Subject in Times of Crisis, which we published in the journal Public Culture in something like 1995. And very briefly, the point we made at that time was that crisis was functioning as what we called a figure of rationality. So the term crisis defined or structured the rationality of people's lives under conditions of austerity. So in that sense, we sort of explored how conditions of life in Cameroon at that time entailed an experience of crisis. Okay, and now flash forward to around 2005, sometime in the mid-2000s, I'm then in Paris. I'm working pretty closely with Michel Calon, who's at the School of Mines, the École des Mines, who is one of the prominent figures in sort of the social, what we now call the social studies of finance. And in working with Michel on finance, I realized that I disagreed with the text I co-authored with Achille. So very strange, but it's true. And what I disagreed with was the positing of crisis as a protracted experience. And this is really important because if you pay attention and you really start looking, much social science work refers to crisis as a category of experience. So at that time, when I'm in Paris in the mid-2000s, I asked, right, if crisis designates something more than a historical juncture, right? Not a moment, a crisis moment, but an ongoing state of affairs. What is the status of that term? So how did crisis, which was, once a signifier for like a critical, decisive moment, come to be construed as a protracted historical and even experiential condition, right? Can one even speak of a state of enduring crisis? So this seemed to me to be sort of an oxymoron. So I embarked on a very eccentric project, which was this exploration of the concept itself. And I used these questions that I just articulated as guideposts. So it's really important to remind ourselves of the genealogy of the concept. What struck me, and this is actually quite astonishing, when I first embarked on this project, was that we have virtually no conceptual histories of the term crisis, right? And that, which means, right, that we treat it as a natural category. And the great exception, of course, is the work of Reinhard Koselleck. And Koselleck's conceptual history, I am not going to delve into it here today. I do that work in the book, and of course, some of you are probably more familiar with his work than I am. But his conceptual history examines the theological entailments of the concept of crisis, right? It's a Christian term of supersession. And I am dramatically simplifying, so please forgive me. But for now, let's just underscore, for the purposes of my comments, that crisis comes to us through Hippocratic medicine to Christian theology and migrates as a concept, right, through political philosophy and social theory. So the term crisis comes to signify for us, and I want to hesitate here to say for us, meaning people coming from, and I'm including myself here, people coming from and making use of that particular Christian European philosophical tradition, which is exemplified quite frankly by Koselleck, right? So for those of us that are mobilizing that tradition, crisis comes to signify a historically unique transition phase, right? What we call a turning point that marks a fundamental transformation of social relations, right? So for instance, Marxist political economists theorize crisis in terms of modes of production or class conflict. Social theorists, inspired by Michel Foucault, my first book is very much in this vein, sees this in terms of epistemological rupture, right? Or the failure of our forms of knowledge to account for our worlds. And this particular conceptual history has engendered what I think are very deep-seated presumption that crises are the result of inevitable tendencies, natural inevitable tendencies, right? These are defined, again, in social theory as contradictions between opposing forces. So the obvious one being labor versus capital in Marxist theory, or discrepancies between competing realities. And this is a lot, I'm in anthropology, this is very much the way anthropologists narrate, right? Discrepancies between competing realities. So the world on the one hand, and human knowledge of the world on the other, which would be critical theory. So the term crisis is thus foundational to the ways that we signify events in our constant apprehension of myriad competing phenomena. So in other words, and this is really the takeaway point, right? Crisis is the primary way that we indicate the significance of events in a realm of constant flux, right? And putting it really succinctly, the concept of crisis qualifies our world. It determines what gets to count as an event. It determines what gets inscribed as history, and I mean that with a big H, as opposed to like all the other observable things that never qualify as being significant, right? It never qualify as being legible, and hence never qualify as part of the historical record. And I think that point was made in the opening keynotes, which I listened to by Blamia and Katerina, which would be an interesting point of exchange for the Q&A. So I can imagine that some of you are asking, like, how is this relevant to the case of the COVID-19 virus, right? And that's a really fair question. It's like, what else could a global pandemic be called but a crisis? You know, and I'm coming from New York City. It's a really good question, right? After all, human life is at stake. So naming a set of events or a situation a crisis sounds like a mere semantic act, right? Like a speech act. And the statement, this thing is a crisis, seems semantically justified with respect to a global pandemic that is raging through human populations. But this is a crisis is not a mere empirical observation that can be unproblematically represented in a semantic act. Instead, this is a crisis is a logical observation. It's a claim. And moreover, and this is what I hope to sort of walk through a bit, it's a conceptual claim, which I would like to explain. Could I ask you to share the screen, please? Thank you so much. So what I have up here is a bit pedantic, and I apologize for that, but it's important to really walk through this, I think. So I first want to talk very briefly about the question of naming something a crisis, right? That is calling an event or a situation a crisis. And I want to do this because naming a set of events or a situation a crisis sounds, as I just said, like a mere speech act, right? That thing is a crisis. So let's say we have an empirical observation, virus. That observation is based on a distinction, virus, not virus. That is a first order observation, right? A virus can only be known, or what I like to say following Niklas Luhmann, a virus can only be observed based on distinctions that define what it is not, right? So then you can have another observation, virus present, meaning there's a virus in my presence or a virus not in my presence. And that's a second order observation based on this first order observation, virus, not virus. Building from that, the claim virus in my presence is a crisis qualifies an observation, and it is conceptual. So in other words, the empirical observation virus is different from the conceptual claim, virus is a crisis. And the point is that a virus is not naturally occurring as a crisis. Saying that it is one, right? Claiming that the virus is a crisis is a way of qualifying an empirical observation. And in this way, that is through this manner of qualification, we bring an empirical observation into the conceptual realm. And we can see how the concept of crisis is foundational to the practice of framing disease as an intelligible, knowable, and of course, historical event. Could I have the next slide? Thank you. So why does this matter, right? Like, after all, a virus in my presence is definitely, it's not a good thing, right? But it matters that we recognize that crisis is a claim because as a proposition, it's our primary means of qualifying the observable world, of qualifying a situation, and of qualifying history, as I just said. So our contemporary world seems to be fundamentally defined by protracted crises. I mean, you just turn on the news, or, no one lifts a newspaper anymore, but, click through a newspaper online, and you can see that each of these corresponds to empirical observations, right? So for example, we have global health crisis, which corresponds to the empirical observations, virus or COVID-19, right? We have environmental crisis, which corresponds to the empirical observations, fires, floods, like warmer ocean temperature. Or we have socioeconomic crisis, which corresponds to statistical representations, such as things like GDP or income distributions. And we, meaning we, social scientists and people working in the humanities, carry out research on these crises to better understand them and hopefully correct them, right? So for example, what I know best comes from finance. When a financial crisis is declared, as it was in 2007, scholars, right, social scientists, seek to describe the impact of the crisis on various populations. So all we have are necessarily post hoc, like after the fact, right, after the claim was made by the Treasury and the American government of crisis, all we have are publications on how the financial crisis impacted people. A very different approach is sort of the one I'm advocating for, would be to stop to first ask constitutive questions about the concept of crisis. And some of those constitutive questions would be, what specifically is identified as being in crisis? When, and I mean this literally, when is crisis declared? And I mean this very literally, and why at this particular moment as opposed to another, right? Crisis for whom and by whom, meaning whose claim? And I mean all those questions very literally. So the ultimate question is, what is at stake when we claim crisis? What are the effects of this claim? And this is an important question because it compels us to be very explicit about the assumptions that structure and inform our efforts at solving the crisis, or more importantly, again, in my view, our manner of problematizing something as a crisis. So solving it means that we assume that we all agree about what exactly is in crisis and for whom. And this means that we seriously consider the tangible effects of the concept itself on the formulation of truth claims. So today, crisis signifies a global health pandemic. And as I said, like, nothing could seem more natural, right? The ultimate crisis for humans is not having an immune response to a virus. Like, this is literally existential crisis, right? The existence of the human species, right, is at stake. However, we do have an immune response to COVID-19, right? We have an overwhelming one that can be catastrophic, unfortunately and sadly, but it's also crucial to our methods for developing a vaccine. So if the global pandemic is not an existential crisis at the level of the human species, right, that threatens the very existence of the human species, what kind of crisis is it? Could I have the next slide? So the most obvious answer is that COVID-19 is a public health crisis, right? Humans weren't prepared to fend off this biological intruder, which was, unusually virulent or transmissible. But as Andrew Lakoff, his cover of his book is here, has shown, we were prepared. Andy has written about what he calls the global health security assemblage. Some of you, I'm sure, are very familiar with this. He traces the emergence of the very notion of preparedness as a governmental strategy in the United States, which involved the consolidation of various forms of knowledge and practices from disparate domains, including national civil defense, emerging management protocols, and international public health practices. He also tracks iterations of formulations regarding what constitutes an emerging disease since the late 1980s, when the HIV/AIDS pandemic put an end to the assumption that infectious diseases had been contained by public health measures. So at that time, the biosecurity agencies concluded, and don't forget, this was 4 decades ago, which is why I'm bringing it up. It was 4 decades ago, that our future global ecology would entail the continual emergence of new diseases for which we have no existing immunity. So, for example, in the late 1990s, the United States Biodefense Initiative prepared for an eventual bioterrorist attack, at that time focused on anthrax. Could I have the next slide? So furthermore, as Lakoff documents in a more recent essay, and I really, really encourage you to read this essay, which is quite formidable and a bit haunting. This essay is on the formation of experimental virology, which was part of the pandemic preparedness strategy. Funding for basic research was also significant in terms of what I just laid out, passing from 15 million United States dollars in 2001 to 212 million US dollars in 2007. That's quite a big increase in 6 years, right? So the outcome was, and this is the point I'm making today, that an entire global biosecurity apparatus was put in place. So did the COVID-19 virus somehow make that national and global biosecurity apparatus ineffective or irrelevant, right? Was COVID-19 a radically different virus or mode of infection? Could I have the next slide, please? So Bryna Sanger, who's an urban policy expert and the co-author of this book, After the Cure, she provides the beginnings of a response. Next slide. So at the onset of the current pandemic, so this was like in March, I don't even know what the date is anymore, but 2020, I guess, she posted a blog that was subtitled, "Lest We Are Forced to Repeat Past Mistakes." And she wrote, and really my apologies for reading the slide, but I'm going to do that to you anyway. The COVID-19 crisis, despite its broad spread and massive economic impact, is not so different from many of the public health crises the United States has faced over the years. But the current environment of political denial, she was writing this during Donald Trump's presidency, weak and uneven policy response, poor and confusing communication, and contentious intergovernmental relations are predictable and typical threats to effective response. They are in many ways challenges of management and competence, more than they are failures of science or public health. So as I said, if science had failed us, we would not have been able to develop, been able to sequence the COVID-19 genome or develop a vaccine. And that sort of failure would have been epistemological crisis, right? That would have been the failure of existing forms of knowledge to apprehend and represent phenomena. So thankfully, epistemological crisis did not transpire. So why then this crisis today? Next slide. So as in the United States, in many countries, including Australia, entire governmental apparatuses for managing an acute pandemic had been put in place over the past decade. And I want to now just refer briefly to, this is a really useful assessment of the public response to the COVID-19 pandemic. It was done in sort of real time. So when the pandemic was declared in France, Henri Bergeron, Olivier Boraz, and his colleagues who are listed here at Sciences Po Paris sort of did this real-time study on multiple fronts. And so even in France, where the quality of public infrastructure far surpasses the United States, as does Australian public infrastructure, what Bryna Sanger called the challenges of management and competence undermined pandemic preparedness. So the authors of this study show how the nature of the regime in power, by which they mean the government, the Emmanuel Macron government, structured the response to the pandemic. So for one, at the time, I'm sure we've all forgotten about this, there were ongoing and very widespread strikes against Macron's reforms. I don't know if you remember the yellow vest protests, which basically shut down definitely Paris and most of the country. So the Macron government's strategy was designed in light of these ongoing strikes and thus diverged from the existing pandemic preparedness map. The study also shows how bureaucratic fragmentation, I'm sure this applies in every country, right? So the formation of ad hoc committees, the challenges that arose between existing agencies and newly created advisory units, and what the authors call coordination, right? So between these ad hoc committees, the existing agencies, and the newly created advisory units. All of that led either to particular responses or, in fact, a lack of response to the emerging pandemic. So in other words, and this is important, this is really my point, right? Institutional dynamics generated a particular crisis or particular practices for managing the COVID-19 virus. So my point is that it's important to account for those practices which constitute the crisis, instead of merely naturalizing the crisis as something that exists outside of sociopolitical relations and institutions. So most importantly, I think, and this is very relevant for Australian citizens and people who are trying to be citizens, in Europe, in the United States, and in Australia, preparedness for pandemic risk had been displaced by a focus on terrorist risk. So this focus is part of a normative regime that puts geopolitical questions, including questions about migrants, refugees, and immigration, above health and welfare questions. This focus speaks to the question of what is at stake in the claim to crisis. So you can stop sharing, and thank you so much for your help. Thank you. So framing matters. Right? Frames create the boundaries for inclusion and exclusion, thereby delineating the targets of intervention and the limits of knowledge. Framing the crisis and thereby formulating the questions that like structure and inform crisis management occur at many levels. There are geopolitical framings, the ones I just mentioned, which are informed by norms regarding what counts as human security. There are also methods for modeling and representing, which are equally informed by assumptions regarding normative life, biological integrity, or what we take to be biological security. So the COVID-19 virus and the COVID-19 pandemic were both largely produced as objects of knowledge and intervention regarding biological security through data sets and statistical models, right? As we know, modeling was used to determine appropriate strategy. For example, as we know in Australia, suppression versus mitigation versus something else. I don't know what it is. The COVID-19 pandemic has become known to us almost exclusively as a statistical visualization, right? Made of curves and waves. And these visualizations give shape to the epidemic, creating what David Jones and Stefan Helmreich have called wave narratives that serve as both predictive devices and persuasive techniques. I have definitely been persuaded by them. So these statistical models and visualizations generate truth claims that are distinct from those that might be generated by possible alternative assumptions about what to represent, how to represent it, and how to mobilize or act upon those representations. So this is a point made, quite forcefully by Warwick Anderson in a recent article he published in the journal Social Studies of Science. I'm sure it has been cited already today. And Warwick, if you're out there, please contribute to comments to the Q&A. He provides an incredibly thorough critique of statistical modeling as a reductive method for making quick and decisive judgments under conditions of uncertainty. Or specifically on the reliance on the reproduction number, right, that row of the virus as the definitive representation of a very complex socio-epidemiological and ecological unfolding. So, of course, we know that models, necessarily reduce complex subjects to single categories. By reducing heterogeneity, we reduce complexity. and hence the capacity to pursue alternative framings and pathways. And that's really Warwick Anderson's point. COVID-19 was constituted as an epidemiological crisis, thus foreclosing its representation in more heterogeneous terms, right? Or as a complex, mutually constituted epidemiological, ecological, and socioeconomic phenomenon, right? As a matter of human welfare and not only biological security. So we need to ask, what best represents human security? And, in my view, to answer that question, we can't blindly accept declarations of crisis. And I want to say that this doesn't mean that they aren't true, right? I'm not saying that crisis as a term shouldn't exist or doesn't exist. It does, right? So the decision to not blindly accept declarations of crisis does not equate with the denial of any one individual's claim that they have experienced crisis, right? That's their claim. Nor is it the disavowal of a community's claim to an experience of crisis. Again, that's their claim. It just implies a commitment to investigate the formulation of crisis, right? How is the claim to crisis formulated? What are its terms? How is crisis constituted as something that we act upon? So it's important to note that this isn't just a matter of giving empirical content to a larger sort of systemic process. And that's really important for reasons of method. Crisis is an object of knowledge, right? We claim it, we define it, we establish its contours and limits, we manage it, etc. And it has differential consequences or effects for various populations and communities. And that's important, right? European social theory tells us that crisis implies a turning point. And crisis involves a turning point because it's said to involve epistemological transformation, right? In other words, and at least according to conventional social theory, crisis signifies the transformation of knowledge production and the production of true statements. But we need to stop and reflect when crisis is declared, to what extent are we in the midst of normative transformation or the emergence of novel normative standards? We should ask, for instance, whether the COVID-19 pandemic constitutes a crisis because certain truth claims no longer hold, right? Is this the case? So, maybe it's too soon to say. Maybe patents for vaccines will become a contested legal category, right? Patents will become for vaccines will become a contested legal category, thereby affirming the transformation of truth claims about property rights in the form of patents and licenses, right, in their relation to human welfare. So, let's not forget, vaccines are governed by private property regimes. And maybe a global vaccination campaign that is financed and managed on a global scale will become standard practice in years to come. Maybe. However, and unfortunately, for the most part, we can see quite distinctly how, in the case of COVID-19, the crisis claim implicitly reconfirms norms about public health and what we consider to be human security. And in that case, there's no epistemological transformation, right? No new truth claims. In the United States, again, the only place I can really speak to, the crisis claim is implicated in very serious and very deep racial and socioeconomic disparities in public health and welfare. And these are the norm. These disparities include differences in living and work conditions. I know that was referred to in a panel earlier today, and differential access to medical care. The response to COVID-19 as a public health crisis didn't serve to attenuate or to address those inequities. So it's definitely true that the 2021 American Rescue Plan Act reduced the poverty rate, actually dramatically. And that's testimony to the power of public welfare. But this represents a one-year reduction, right, for 2021. And that's largely dependent on federal stimulus checks that are paid directly to families. These relief programs end, and actually it's now. The structural causes of precarious welfare remain. So the claim to crisis is only served to exacerbate socioeconomic inequalities because public welfare is not a core feature of pandemic preparedness. And this is the case in the United States, which is, of course, one of the more dramatic examples of income inequality. But food and housing insecurity has increased in countries across the world. I don't know what the situation here is in Australia. I would be curious to know. And these inequalities are definitely global in scale. I know this from my work in Africa, and they're exacerbated by vaccine nationalism. So regrettably, and despite longstanding pandemic preparedness regimes, which I referred to earlier, public welfare is not included in the Global Health Security Index, and which is the standard bearer for benchmarking different countries for their capacities to manage what they call catastrophic biological events. So sadly, despite grossly widening socioeconomic inequalities, both within nations and across the globe, and despite all the suffering and ongoing bereavement, I can say this coming from the United States, human security defined in terms of public welfare has not emerged as a new normative regime. So in closing, and I think my time's almost up in any case, I'd like to just respond more directly to the theme of the conference regarding the role of the social sciences and humanities in a pandemic world. I think what I've presented today, or I hope what I've presented today makes the case, for the study of crises as exemplars, right? And what I mean by that is we should study them in terms of the practice of the concept of crisis. And from a research point of view, that definitely involves accounting for actors' uses of the term, right? Like an account of discursive practice, right? Or how people, and I mean both expert and lay people, how they use the term. But more importantly, and what I'm driving at, it also entails an account of the tangible effects of the concept itself on the formulation of truth claims. And one way we can investigate this question is to consider whether or not declarations of crisis entail changes in normative regimes. So before rushing to research crises, and there's no lack of crisis declarations out there, that's sort of all we hear, right? So before rushing and therefore participating in and perpetuating the apprehension and understanding of our worlds as defined by crisis, we need to step back and think about the grounds of our knowledge production. So as scholars or people working in the social sciences and humanities, we need to ask, how is the claim to crisis formulated? What are its terms? How is crisis constituted as something that we act upon? And we should remember that, at least from a pragmatist point of view, which is my own, all concepts are practiced, right? And their import lies in the forms of the realization. So I'll stop there and hope that I can hear more about people's thoughts about, the situation in Australia. So thank you so much.
That was wonderful, Professor Roitman. Thank you so much for that really just wonderfully stimulating and productive presentation. So we have plenty of time for questions and discussion, which is really terrific. And there are a couple of ways that people can go about asking a question. Please use the raise hand function if you would like, and we'll just invite you to unmute yourself and ask your question. If you would prefer, you can also pop your questions in the chat, and I'll keep an eye on that and read them out. Maurizio, you've got a question there.
Yes, thank you, Janet. Very fascinating presentation. I wonder if, going back to your initial point about the Hippocratic and Christian root of the word crisis. So, two things. In both cases, there is an external authority, a medical authority on one side, or a religious authority, a confessor on the other side, establishing that the critical point has been reached. So that's interesting. So there wouldn't be a crisis without a sort of subjection of someone, a patient or a penitent, to some sort of knowledge. But also it's interesting that in both, although I think Hippocratic and Christian roots are quite conflicting at several levels, but it's true. I think that the concept of crisis in religion is very much taken on this biological framework that Hippocrates established. So with a critical moment where either the disease can kill the patient or instead can release him, and often is associated with notion of fever. That's interesting because it's a model in other areas that continues to be very dominant. In models of developmental plasticity, there are critical windows of plasticity where some environmental exposures are particularly important, and the body is particularly sensitive to be marked by. So this is to say, coming back to the point, there is both an establishment of an external authority to make the crisis possible, and both there is a persisting biological idea of what crisis is, which I think it's interesting in this context.
Yeah, happy to comment on that. Can everyone hear me? Yes, okay, sorry. It's always so alienating being on the screen. Yeah, thank you so much. You know, Koselleck walks through this conceptual history, and part of my goal wasn't really to enter into the theoretical debates about what crisis is or is not in historiography, but I do want to highlight some, you know, one of the really interesting what you just pointed out. I want to highlight that the idea of crisis as a turning point is so significant because crisis was not the disease, right? Crisis was the critical moment in which a decision had to be taken. That was the crises, right? That was the significance, the signification of crisis. Whereas today, and you know, I'm an anthropologist, so I'm really speaking from, you know, the realm that I'm in, and this is why I disagree with the article I co-authored with Achille. You know, we just talk about crisis as disease, as sort of this experiential state of affairs that we are in, and I think, unfortunately, when I became sort of more aware of crisis, as I started looking into this, it's like, show me a social science book that is not narrated using the term crisis. No, and there are many reasons for this, right? One of them, I mean, is what gets to count as history, right? So I think your point about, you know, I'm not speaking really from history of medicine kind of realm, but, you know, the authority to narrate and generate historiography really does matter here. There's some things I could say that relate to, some people always ask me this question about environmental crisis. Well, of course, that's a crisis. So maybe later I can say something about that. But just for now, you know, one of the things that struck me when I finished the book, Anti-Crisis, was I read a huge amount of the Financial Times for that book. And as I was reading the Financial Times, it's just constantly this barrage of journalism, not academic writing, but journalism on the rise of the middle class in Africa. And so I looked into it when I finished Anti-Crisis, and there was zero, not one article from sociology or anthropology on the rise of the middle class in Africa. And like, why is that? Well, because it's boring. It's not a crisis. You know, everyone's writing about Ebola, you know, and like, so I started really talking with my students about this. Like, if I wrote to some granting agency and said I was going to go sit in the mall in Zimbabwe, in Harare, you know, and hang out with people shopping in the mall and buying their new iPhones and like watching porn at home, and I don't know what they're doing, but you know, like that, I'm not going to get money to do that, you know. So the way our scholarship, you know, the criteria by which something counts as scholarship, even not that's a separate point from what counts as, you know, as historical as an event and gets inscribed in the ledgers of history. But I do think there's real reflection about the kinds of things that we take to be legitimate objects of inquiry as well.
So we've got a couple of questions in the chat. So one here from Tyler Riordan. Thank you, Janet. It's fascinating, strongly agree. In some of your other works, you speak of ongoing crisis in terms of COVID and other crises, e.g. precarious work. At what point does a crisis end and just become normal, quote unquote, or status quo?
Yeah, great question. That's part of my worry, in fact. So I think really what you're hitting on is the place where I started questioning the work that Achille and I had done. And partly because one of the things I tried to do, and it's in a piece called Africa Otherwise, published in a book called African Futures or something like that, is to think about how you would narrate Africa other than under the sign of crisis. So I actually distanced myself. I know I've written it in places, but sorry. So I actually distanced myself from this idea of ongoing crisis, partly because I don't think it's helpful. It doesn't help me think. It doesn't help me get to some of the either epistemological questions that I think are most important. So that's a personal or political questions, and that's a personal decision. I do want to say though, there's an exercise. It's a funny exercise. There's a question that's asked in, like, I don't know if it's like phenomenology 101 or philosophy 101, but it's this question about a tree falling silently in a forest. I think some of you have probably heard this. So if a tree falls in a forest and like there's nobody around to hear it, does it make a sound? Right. So when I was first asked that question, I thought, of course it makes a sound. I'm just not there. Right. So this gets back to the witnessing question though, right? So the answer is actually, or one of the answers is actually no, because sound is an attribute of human perception. Right. What the tree makes when it falls are wave disturbances, and those wave disturbances are processed by the human brain. So sound is actually something that's in my brain, is produced by my brain. So the answer is no. So I rephrase that question, right? And this is like an old rhetorical thing, but still, the alternative would be, if a tree falls silently in a forest, none of us are there to witness it, is it part of history? If there's no witness, how does it become an event? And that's sort of what I was referring to in my comments about what gets to count, what gets inscribed, what do we write books about? What gets on the news, all of that, right? And now I just want to do one, sorry to belabor this, but the other thing we can ask, and I asked myself this, if a tree falls silently in the forest and none of us are there to witness this, is it a crisis? Right? And then the question really becomes, and this relates to the first keynote speakers, the points that they were making. It sounds very like anecdotal, but I think it's very important. There were trees falling and there were fires, and they were not taken to be signs of, for example, environmental crisis over the past decades, right? As fires were happening and trees were falling, right? They were seen as signs of something by some groups, i.e. indigenous communities. They certainly saw them as signs, maybe they didn't call it environmental crisis, but they certainly had ways of narrating that as problematic. I don't know, I don't want to put their terms into their mouths, but I think it's a really important point, because it underscores the point that the claim to crisis is a political claim. We, meaning we, I include myself in this kind of like white Euro, North American, Australia, I don't know what, but we are only now starting to narrate human history in terms of environmental crisis, or what we're calling the Anthropocene, right? As like a fundamental premise of our history, despite those decades, if not a century, of global warming and degradation. So I think that really makes the political point I'm trying to make. So it was a roundabout way of answering your question, but sorry.
So we've got quite a few questions coming in that we might not be able to get through everything in the time that we have left, but I'm just going to go through them in the order that I've seen them come up, and we'll see how we go. So Warwick Anderson was in the room, and he's got a question here for you, Janet. Is there an Indigenous conception of crisis? So I guess this follows on perhaps from your comment. Since Koselleck says crisis is the signature conception of European modernity, I expect not, but what may be an Indigenous alternative mode of knowing an event? I suppose I'm asking what alternative temporalities are available, and how do they reframe or reconfigure the situation?
Yes, first, hi Warwick, and great question. I wish I had an answer. I mean, in some ways, no, actually that's really helpful. It does follow really, really nicely from the question that was just asked by Tyler. And I think that question just sets up future research. And that's how I see it. So just, to refer back to the keynote speakers, who I also don't know if they're here, but, I was thinking about the way that it's almost like it's so deep to kind of go for crisis as the way of narrating. And I didn't speak up during the first keynotes, but I was thinking, like, by using the term, so I'm sort of looking at my notes from that session, but, by using the term crisis, right, for Indigenous peoples anywhere in the world. I think about Africa was certainly, colonized in the most brutal, dramatic ways. When crisis is mobilized as a way to structure thought or narrate, then we're one move away from the terms genocide, from the terms extraction, rape, mining. Those were the references this morning, and whatever else. It's not for me to set those terms. I have my own family history that can certainly, do that work in a different setting. But I think it's really important that the way that crisis kind of naturalizes, and frames it all in terms of this unfolding human history, or ecological history or something like that, is problematic. And so I would love to know what those other terms are. I would love to know when the fires first started happening, what were local terms for understanding what was happening? Is there an equivalent crisis term or not? Either way is all good.
Yes,
but
Janet, I think what I in effect was asking is how do we think about decolonizing crisis, as you say so eloquently? I mean, that it is actually a colonial term in a very powerful way and very pertinent way. And so how do we go about decolonizing the concept of crisis?
Yeah, cheers. I mean, I can only agree, but also to the point of some of the things that were said in prior panels, who was seen as carrying disease, et cetera, right? So today, in terms of immigration, it's crisis for whom? That's why I keep asking the question, right? Crisis is like the immigrants and the refugees, but it's actually crisis for people trying to maintain, right, the boundaries around certain lifestyles and certain modes of consumption and et cetera, et cetera. I'm not saying anything I think that people on this Zoom call don't know. So, but absolutely, Warwick, and thank you. Yes. Yep.
Louise Johnson, I think I've got a question here. I can read it out, or if you want to unmute yourself, you can hear less of my voice.
Yep, sure. Look, I want to say thank you. I'm not an anthropologist, I'm a geographer, but really interesting and fabulous insights. And being a geographer, I can't help but notice you have bars on your windows. And I was just wondering how that relates to a social geography of where you live, because of course the pandemic for us really did expose the inequities across cities and spaces, as well as social and spatial groupings. And I'm just wondering about your own possible crisis, which necessitates you putting bars on your windows.
Yeah, cheers. This is actually an old warehouse. Those are structural. We're not afraid of anybody. So that's very funny. This is like I'm standing in an old warehouse actually. I'm not sure. Thank you for the question, Louise. I'm not sure whether you mean crisis in New York or in Melbourne.
Well, yeah, I'm just actually making the connection between that notion of differential impacts of the virus, or whatever crisis you want to point to, or rupture, sure, or challenge to the particular social and demographic layouts of cities and communities, which is a point you've made. And I just saw the bars and I thought, oh, that's interesting. And I was just relating it to that. So a bit of a cheap shot, but I mean, it's also even a warehouse has to protect property. So, I mean, there's something going on there, like any spatial configuration. That's all.
Yeah, absolutely. Yeah. So I, for one, hope to never have to live in a place with bars. But secondly, your point's very well taken. You know, I was in New York City for most of the pandemic, and you know, I'm assuming this is just true everywhere. And I would love to hear people. I would really, actually, sincerely love to hear people's thoughts about the situation here. You know, New York City has, you know, one of the most grotesque, you know, inequities and inequalities on every level. So, you know, neighborhoods where people live in really, really densely packed, what you call commission housing here, obviously were terribly affected. A huge part of the population does not have healthcare, meaning zero. There's no universal healthcare. Yeah. You know, the list goes on. But you know, the one thing that really was very striking, which I think we didn't know, was really the peril of frontline workers, essential workers, right? Who still were delivering, who still had to get from, you know, very far away places into the center of Manhattan to do whatever they were asked to do, and died massively from the, well, the wealthy, and this is still true, you know, the wealthy all went into the rural areas. And I'm assuming there's a similar dynamic here. And I'm, you know, yeah, to your point, I think the difference, of course, would be that there is a baseline in terms of healthcare protections.
Yes.
Yeah. So.
Yep. Anyway, lots of other questions. Thank you.
Thank you. Yeah.
Okay, we are going to run up against time in a few minutes, but let's see what we can get through. Brett Nielsen had a question in the chat. Again, look, I can read it out, but Brett, if you wanted to unmute and ask that yourself, you're welcome to.
Yeah, hi, I'm here. Can you hear me?
Yeah, we can.
Yeah, I'll make it quick, but I just noticed, Janet, that you were often using the word catastrophe or catastrophic, and it resonated with me with a quote I was reading from an article earlier this week, and I'm just wondering about the stakes in using other concepts apart from crisis. I guess it's a little bit like Warwick's question, but you know, more kind of confined to a sort of Western social science framework in terms of alternative concepts like catastrophe that are often mobilized. Do they get us out of the dilemmas you're describing, or do they just get us into other ones?
I'm sure they get us into other ones, right? So, I mean, there aren't any terms that sort of don't carry with them their genealogies, you know. So it's so funny, I didn't realize that I was putting catastrophe there. But I think that maybe, you know, maybe I, in some ways, would give you a very standard anthropologist's, you know, response to that. This does continue from Warwick's point, is that I would like to know what people's terms are. And the reason I say this is, like, you know, it feels like crisis happens and then things follow from that. And there's a politics of crisis, right? And I'm actually a little wary of all of these terms, because we're just in this big cacophony of all of this. And the crazy thing in 2007, when the financial crisis, what we now call the global financial crisis, was declared, the problems in the subprime mortgage markets existed for years prior. Those markets were there was never enough capital there, ever, and everyone knew it, right? People were betting on risk. They were betting for those markets to fail. So I'm not going to get into the finance of this, but I think it's really significant that we, instead of just sort of assuming, you know, this crisis happened and then we're all going to investigate it, to like think about what are the constitutive terms that make it such that that is declared, and then all these things are going to follow in terms of like what kinds of questions it sort of enables and what kinds of questions it forecloses. And I tried to sort of walk through that today. I would say, you know, the same would be true for catastrophe or emergency or anything else. You know, now that I'm working in Africa, I'm not able to really go there just yet, thanks to all the lockdowns. But I'm very curious. It's very interesting how there are sort of other things at stake for people in West Africa right now. They're the big debate there right now is decolonizing their currency, you know, which is like nothing we talk about here. So I think it's just really, really attentive to be very, very aware of like the terms that are actually being articulated before kind of gathering it up into these big conceptual terms that we as social scientists need. But just to be more, self-reflexive about that. So, yeah.
Look, we are on time. I'm just going to take one more question from Tim Heffernan. I'm sorry, I know there's a lot of really interesting comment and questioning going on in the chat, and we're just not going to be able to get to everything, but I do encourage people to continue talking and commenting. Tim, we'll take a question from you as a kind of final question for this session.
Thank you, and thank you, Janet, for a wonderful talk. It's a bit of a potentially a dense question to end on, but that's okay. I just wanted to quickly ask, I was intrigued by you talking about how all concepts are practiced, and to think about where we are in that in terms of knowledge. And I wanted to ask, what do you mean by crisis is an object of knowledge rather than just knowledge, as you kind of link in the book around the fact that when crisis is seen as a philosophy of history, crisis is history itself, or I think that's what you say.
Yeah, no, absolutely. I could give a very long answer to that. So that's a really, really important question. Thank you for that, Tim. And it's nice to sort of meet you. Well, I guess one thing I should say is I just want to make a quick distinction if I can. I know we're sort of over time, but between, you know, I raised this thing about distancing myself from the text that I co-authored with Achille, because I was concerned about, you know, about the framing of crisis as experience. So I want to first talk about that before answering your question, because the question is sort of, how do I know your experience of crisis? Right. So what struck me when I was doing research, or what I get from people is discourse about their experience of crisis. Right. There isn't any immediate knowledge of anybody's experience. Right. This is sort of a critique of phenomenology. Right. So there's that. And I became very sensitive to that question. And then I just want to say something else, that, you know, if we take crisis as an epistemological impasse, if we take it actually on its terms, seriously, like the way it was framed in sort of social science and political philosophy, that is an inability to represent. How do you know something that you can't represent? Right. So, you know, the way I like to sort of remind myself of this is Adorno is like, there's no poetics after Auschwitz. Like you can't represent that experience. You know, so people can, you know, there are all sorts of testimonies about Auschwitz, but I don't think I know anybody's experience of Auschwitz. Right. And his point about no, you know, poetics after Auschwitz, and I'm sort of paraphrasing him, but is that you can't represent it, even in a poem. It's not even talking about some rational argument. Right. And I also take that very, very seriously. So that's part of my, you know, I didn't say this in my presentation today, but those are sort of some of my other underlying concerns about the concept. So when I say it's an object of knowledge, it is something that is claimed. And I tried to sort of walk through in the pandemic, but, you know, I sort of know the finance stuff better. But literally, let's just take the GFC, the global financial crisis of 2007, 2008. People, literally, men, went into a room, right? Like, I could give the list of who they were, big people in governments and finance, went into a room and decided, we are going to press tomorrow. We are going to publish the Financial Times, the New York Times, you know, whatever else, and put on the front cover in font, this big, financial crisis. Everyone knows how fucked up that is. right? Like that's the worst thing. That's every government's nightmare. Why would they decide to do that? Right? And so we have to understand this is a political decision. What they did was they used taxpayer public money to bail out private institutions that had been betting on risk and creating huge debt and risk markets. My daughter's schools in New York City were gutted to pay for those banks, gutted. And those people still got their paychecks and their bonuses, right? So the politics of this really matters. And that's why I'm taking this very literally. It's an object of knowledge. It's something that's declared, and apparatuses go around it in terms of defining its contours. You know, what is in crisis? They were saying, you know, the markets, like it wasn't really phrased in terms of private capital. So we were able to socialize those private losses. So I hope I'm sort of making this clear as examples of what I mean by it's an object of knowledge. But it really is something that is declared and narrated, and it gives structure to a lot of sorts of disparate events and disparate situations. So that's the best I can do in the short period of time we have, but happy to continue the conversation. And I should say, you know, happy to, the book is there, of course, but this is based on an essay I wrote that is, you know, hopefully will be out for people to look at if they're interested. So yeah, thank you for the great questions, everyone.
Thank you so much. And I think that is a really wonderful note for us to end on this question of what happens when you unsettle and unnaturalize the terms of crisis, and what does that mean for the stakes and the terms of political struggle also? What do we do with that once we have unsettled and interrogated that? So look, Janet Roitman, I want to just extend a very sincere thank you to you for your wonderful talk today and your generosity in engaging with all of us. Thank you to everyone who came along, asked such wonderful questions. I am really sorry that we haven't got through everything, but do please continue the conversation either kind of on the Hoover conference page, on Twitter. I know lots of people have been tweeting through the conference, so please do share your comments and your questions there as well. And look, we hope to see many of you back tomorrow for day 2. So thank you again.
Thank you all. Thank you so much for the great questions and the attendance. Yeah, thank you.